it's necessary to make a brief comparison of what we had at the beginning of the revolution in 1959. On that time, we had around 6,286 doctors, most of them located in the main capital of the provinces, and they dedicated to private practices. At the beginning of the revolution, okay, the 50%, around the 50% of them migrate to different countries, mainly to the United States. It means that for a population of around 80 million of persons, we had only 3,000 doctors. Infant mortality, as you can see, was higher than 60 per 1,000 alive birth. Life expectancy less than 60 years. Sanitary hygiene situation was overtaken mainly by non-communicable diseases, many of them preventable by vaccines. Our illiterate population represented on that time the 40% of our population, and we had only one school of medicine. Compared with the current situation, at the end of last year, we can say that we have more than 72,000 of doctors in Cuba. It's one of the highest rate in the world according to the inhabitants. Infant mortality was 9.9 per 1,000 alive birth. I will talk later about this indicator because it's one of the most sensitive for the development of the countries, and it has a real negative impact with the U.S. blockade, and I will talk later about that. Life expectancy is 77. In a few years, also has decreased. Okay, used to be 80 for women, even in Cuba. Sanitary hygiene situation is mostly related with non-communicable diseases like developed countries, for example. And there is one immunization program that I will talk later that protects against 13 diseases. According to the latest data published by UNESCO, Cuba has a literacy rate of 99.75%. That means that there is no illiteracy in Cuba. Okay, we have now 13 medical schools, 29 faculties of medicine, the Latin American School of Medicine, 4 faculties of dentistry, 5 faculties of health technologies, nursing, and the National School of Public Health. In our Constitution, is well recognized the right of all citizens to have access to a high quality care, free of charge, despite your beliefs, political affiliation, the color of the skin, is well recognized in our Constitution. Okay. According to the principle, how is structured the national system, we can say that it has a very strong international conception. I will talk later about that. It's regionalized. That means that we have high standard medical care in all provinces of the country. That means that people that are living in far areas from the main capital don't need to travel such as distance in order to receive high quality care. It's intersectoral also. That means that it's not only a responsibility of the Ministry of Public Health to provide medical care. There are involved all ministries in that: Ministry of Communication, Justice, Tourism, political organization, the community. All of them are part of the system, they are main focused on preventive medicine and promotion of health. In my country, we consider that a genius is not the one that can perform a cardiac transplant or a liver transplant. Of course, they are a genius. We consider a genius the family doctor that works in a community and can prevent the cirrhosis of the liver and avoid the need to go on to a liver transplant. That's preventive medicine. And preventive medicine is also less expensive than hospital. That's why we invest more in primary health care. Our network is Okay, we have three levels of care in Cuba. Primary health care, the one that I was talking about, is our main strength, and we try to solve at least the 70% of the main problem of the community. The most important is that most of the doctors live in the same community that they work. Secondary level are the hospital, and tertiary level, the research institute. It's a right for any Cuban citizen to go to any level of care. It's their decision. They can go to primary health care, to a hospital, or to the tertiary level. But most of them goes first to primary health care because the service is in a walking distance, is in the same community, and and we reserve with that beds in hospital for more complicated cases. Uh, but it's a right to decide in which level they want to receive the medical care. These are some of the institutions that we have in the whole country. Okay, in primary health care, 452 polyclinics. That is the main cell of the primary health care, with more than 10,800 of medical offices. That's the place that the nurse and the family doctor works. We have that system in the whole island. 100% of Cuba is covered, at least even in disadvantaged area or rural areas, for at least a doctor and a nurse. In primary health care, also, we have 142 maternity homes. This is not a hospital. Okay, this is an institution that we send the women, the pregnant women with some risks for the pregnancy. If we can control that risk, we return back home, or if not, we refer to a hospital. Uh, Different dentistry services, elderly home for the care of adult people, and research institute, as I mentioned, beside another institution. In general, we have more than 390,000 of health workers in the national system. According to the budget, because medical care is free in Cuba, but it has a high cost for sustainability for the government allocate for medical care and social assistance around the 26% of the budget. But if we add the 24% that is allocated for education, we can say that the 50% of the budget is for health and education. Uh, yeah, that one. Yeah. Okay. In the first slide, we talk about the second slide, we talk about the internationalist conception. Okay. During more than 63 years, we are providing medical care solidarity worldwide. Um, That started in Algeria in 1963 when we sent a medical team on permanent basis. But it's one antecedent even in 1960 when we sent one small for a short period to Chile to support them when they were hit by an earthquake on that time. Currently, we are in 55 different countries with more than 21,000 of health professionals. A special mention need to be with Henry Reef Brigade. Henry Reef Brigade is one contingent specialized in facing serious epidemics, and natural disasters. That contingent was created by the Commander-in-Chief Fidel Castro in 2005 when Hurricane Katrina hit New Orleans. Of course, the government of the United States refused the offer of Cuba. But from that time up to now, we have been sending more than 13,000 of health professionals into 57 countries, 89 different medical teams. During Ebola, we sent 3 medical teams, 265 health professionals to Western Africa. And more recently, during the COVID-19 pandemic, we sent 52 medical teams to 58 to different 42 different countries. I was one of that doctors that I spent 2 years in another country fighting the COVID-19. In 2017, WHO granted the award Dr. Lee Jong-wook to this to the Henry Reed Brigade for its contribution to public health. During that period, more than 605,000 of health workers have been in 165 nations. But it's also important as a contribution not only medical care provided, also the training of the human capital, the human resources for health system of that countries. During that period, more than 51,000 of doctors have been trained in Cuba. More than 42,000 as a general doctor, and around 10,000 as a specialist. The 40% of them have been graduated or belongs to the Latin American School of Medicine. The Latin American School of Medicine was created also by Fidel when in 1998 hurricanes George and Mitch hit Central America. More than 10,000 people lost their life. And he said, no, okay, we are going to send solidarity medical teams, okay, completely for free, to all of that countries. But also, we are going to train their human resources also. That's why in 1999, in February 99, is inaugurated the ILAM, with the first 1,900 students, mainly of them from Nicaragua. And we still receiving students from different parts of the world, including the United States. We are training a student from the United States, a student that come from disadvantaged community, a student that belongs to minorities in the United States. We are training for free in Cuba also. All of these achievements couldn't be possible without a strong biotechnology industry. Another idea of Fidel. On that time, lots of people from different parts of the world, including leaders from different countries, said, Fidel está loco. Fidel is crazy. Because they said that biotechnology and pharmaceutical industry is not for undeveloped countries. They said that on that country. Okay, I just want to mention some of the products that undeveloped country has created for Cuba and also for the rest of the world. Okay, at the beginning I said that during at the triumph of the revolution there were not immunization program. Okay, we have now one immunization program with 17 vaccines. 10 of that 17 vaccine are produced in Cuba, are produced by our biotech industry. During so many years, the first vaccine, the one against meningitis, was the only one vaccine of this type to protect children in the whole world during so many times. Another product is the therapeutic vaccine against lung cancer. Okay, Symavac EGF. That vaccine, compared with the previous one, is not preventive. It's a therapeutic vaccine against to the non-small cell lung cancer with very good result. If you open the webpage of Roswell Park Institute in the United States, you will say that they said, okay, we are the only one facility in the United States that provide the Cuban vaccine, because a clinical trial, okay, they are doing a clinical trial with this vaccine. Another amazing product that is unique in the world, there is no other similar to this one, is the Heberprod P. Okay, this medication protects against the or prevent the amputation of lower limbs in case of diabetic foot ulcer. In case of a diabetic foot ulcer, with an efficiency of the 75%, and it's a medication that we apply in primary health care. We don't apply this medication in hospital, probably in one research institute that is the Angiology Institute, okay? But it's a medication that our family doctors apply in primary health care. Even has been applied in case of a gangrene, in advanced and large ulcers with very good results. Probably our surgeon in the near future will be necessary to train them in amputation because they are losing their skills. Okay, in Cuba, there is no amputation for diabetic foot ulcer. It's rare. Yeah. Okay, I just mentioned some of the achievement that we had in normal condition. Okay, but there are some challenges that we are facing. Okay, the aging of the Cuban population. Okay, in a few years, more than the 30% of our population will be over 60 years, associated with a low natality and fertility. The fertility rate in Cuba is 1.1 per couple. Even there is no replacement. There is no replacement for the number of women that we have in our country. That is a serious demographic problem. The increase of non-communicable diseases, antimicrobial resistance, climate change. We are on a small island hit frequently by hurricanes. Research and technological innovation, the high cost of that, okay, that we need in our hospitals, and the economic financial embargo imposed by the United States. We have facing this embargo, this blockade for more than 60 years that recently mutated in another way. Another one more aggressive, qualitatively and even quantitatively more aggressive. That is the energetic asphyxia, no oil for Cuba. During the last 6 months, we are only receiving one shipment of oil for Cuba. That explains the long cuts of electricity, 20 hours daily or even more in some areas in the whole country, and more, and the impact in the health sector. There is no any sector that escape from the effect of the blockade. And one on the most sensitive is the health sector. Just to mention, from last year, from March 2024 to February 2025, we have a negative impact in more than 288 million. And the accumulated impact only in the health sector is more than 4 billion of US. Also, the inclusion of Cuba in the list of countries that sponsor terrorists also limited our financial transaction, everything. Okay, the situation is completely complicated in Cuba. Um, this slide I included because I just want to share with you the situation during the COVID-19 pandemic. Even during that time, there was no any flexibility regarding to the blockade. Okay, for all, there was nothing. Okay, that make easy the life of Cubans during that period. During that time, we have no access to the market to acquire lung ventilators. Our scientists create our own ventilators, and that was the one that you use during the pandemic. Our oxygen plant, okay, was damaged during that time, was out of service, and we request the support from to the United States. Yeah, and they say no, no spare part for Cuba, no medicinal oxygen for that, and Southerners' life, okay, we lost because of the lack of oxygen on time. We had no possibility to have access in the market for raw material to escalate our production of our own vaccine. We work in 5 different candidates and we create 3 vaccines. And with that vaccine, we vaccinate all the Cuban population, including Cuba was the first country in the world to vaccinate children from 2 years from 2 years old. Was the first nation to do that with our own vaccines. How the blockade is translated? Okay, cancellation of contract. Okay, trade contracts, memorandum of understanding, agreement, the refusal of shipment. Okay, of shipping company to transport cargo to Cuba. It's really difficult to us to receive everything that we need. Inability to use or to buy medical devices, equipment made in the United States. or in any other country if that medical device has 10% of more of component made in the United States. That is one extraterritorial policy, but it's real. Persecution of sources of income, any source of income, huge penalties for the bank that make transactions with Cuba. Prohibition of academic interchange, and many others. This is one important line that I updated previous my to travel to my trip to Canada. This shows the equipment that we have in the whole country. Okay, according to computer tomography, CT scanner, we have 78 units in Cuba, but only 32 are operational. The rest are damaged or out of service. Angiograph, we have 9 units, but only four are operational. Magnetic resonance, MRIs, scanner, we have 21, but only 4 are operational in Cuba. Digital X-ray machine, 16 units, but only 11 are operational. Fixed X-ray machine, 700 units, and 553 still operational. But I need to highlight that we have some equipment with more than 20 years working in hospital. Our biomedical engineer works like a magician or like a cyborg. I don't know what they are doing. Okay, but we have equipment with more than 20 years in our country. In order to diagnose and treat cancer, because cardiovascular disease and cancer are our main cause of death, linear accelerator, we have 6, but the average technical availability was only the 33% during the whole 2025. Cobalt therapy, 12 units. The average technical availability was the 83%. Brachytherapy, 6 machines. The average technical availability was only the 4%. Imagine how many patients with cancer we couldn't provide the adequate treatment because we have no spare part to repair the equipment, or new equipment, was not possible to have access. Okay, the leading cause of death in children on the 1 year old during 2024 and 2025 was the congenital defect, congenital malformation. Okay, because they is the okay, we have, as I said, we have no access to new technologies. Okay, we have lack of ultrasound equipment, and we cannot diagnose as early as possible some of these defects that sometimes need to be treated intrauterus. Okay, and we have no. That's why that indicator is increasing during the last few years. Difficulties in obtaining medication used to treat childhood hematologic malignancies. In our policy, like in different countries, we have first line, second line, and third line of treatment. We don't have first line of treatment in Cuba. Okay, when we use that first line, the percent of survival exceed the 75% in children with that malignancies. Now we are using second line and third line of treatment, but our efficiency rate fall from 75 to 60% of probabilities of survival in this group. Assisted reproduction services. We used to have this system in Cuba, but we have lack of materials, embryo culture. This is a high-tech technology, and because it's a human right for all women to have their descendants, to decide it. Okay, we are sending most of the couples, to fertility clinics abroad in another countries, and we are paying a lot of money in order to secure that. As I said, this is one of our main problems as a demography problem, and we are doing that in Cuba. I talk about biotechnological industry that in normal condition, okay, secure the essential list of medicine. Our essential list of medicine include 651 items. 250 is not possible to produce in Cuba, but 401 in normal condition. If we have the raw materials and everything, we can produce in Cuba. The real situation is our biotech industry is only producing the 25 or the 30% of their own capacity. That's why there is no medicine in our pharmacies, there is no medicine in primary healthcare, there is no medicine in hospital. That's the reason. That's the real reason. Okay, these are some of the indicators that also are really impacted by the U.S. blockade. Neonatal mortality, that during some period has showed some stability in Cuba. During the recent year has been increased. Now it's 4.2. Most of you or different person can say, okay, it's low. Yes, it's low, but it used to be very low, very low. Infant mortality rate in 2024 was 7.1 per 1,000 alive birth. As I said, in 2025 was 9.9 per 1,000 alive birth. But I need to highlight that in 2020, before the pandemic, the infant mortality in Cuba was during 11 years, that was between 4 and 5. It means that now it's the double. It's the double. Okay? It's still being low, but it's the double. It has a severe impact with the US blockade. Nutritional indicators suggest moderate but persistent challenge. In 2024, 7.3 of children under 5 years of age were stunted, and 7.6 of newborn had low birth weight. That means less than 2,500 grams. That reflects, okay, nutritional vulnerabilities. Okay, lack of access to adequate nutrition. That's the impact. According to neonatal care and the electricity supply, okay, electricity supply is important for the whole care system, but neonatology unit are very sensitive with that. That need a continuous electricity supply, okay, for the sustainability of incubators, long ventilators. That's why also, okay, neonatal mortality is increasing also in Cuba. General mortality also have been increased. There is one indicator that is called premature death. That means that is for a group of persons that suffer from some chronic illness, but you are not expecting that that person pass away in some in a short period of time. Okay, but that group of medication need continuous supply of medication, medical examination. Okay, that is not possible to provide. 5 million of persons in Cuba are living with some kind of chronic diseases. It's important to say that we are including 16 patients that need radiotherapy, but I already mentioned the situation with our oncology equipment. There are on chemotherapy more than 12,000 of oncology patients. Currently, we have something that we don't used to have so many years ago, a surgical waiting list. Surgical waiting list is around 100,000 of patients that are waiting for the opportunity of some kind of surgery, including more than 12,000 of children. We have been forced to postpone that surgeries in order to secure emergencies, in order to treat life-threatening diseases related with cardiovascular diseases, also with cancer. There are more than 34,000 of women in pregnancy that have, uh, as I said, that are facing nutritional access, that they have no access to adequate nutritional, yeah, uh, medical care, ultrasound, as I mentioned before. That's why our congenital defect also are increasing. The fuel restriction, I include that one because also our ambulance response in emergency, okay, is limited. Is limited. Also is affected, okay, normal transportation, okay, normal transportation for all population. That means that we have hospitals, that means that we have the doctors, but now there is a serious limitation to have access to the medical services. It's a serious limitation. I'm highlighting this at the end because the most important is not the number or the indicator that I mentioned. Behind that number, there are patients and family that they are suffering because they are waiting for a solution of a medical problem, solution that sometimes is delayed or never come, never arrive at the solution, and that is that is a reality. I need to mention also, okay, what the U.S. Government is doing against to our medical brigades abroad. Okay, they are accusing us of human trafficking. Human trafficking, okay, and we are just sending solidarity. It's true that we are receiving some incomes for medical services abroad, but I mentioned 55 different countries now, but no more than 20. For more than 20, we are receiving incomes that is perfectly accepted by the United Nations. Okay, and 100% of that incomes are for the sustainability of the medical care in Cuba. The 100% of that, and all of the actors know the harassment of U.S. officials against to ministries of health in order to stop the cooperation, like exactly like they did with Honduras, like they did in Guatemala, in Jamaica, yeah, Brazil. Brazil was one of the examples. Okay, in 5 years, 13,000 of doctors works in the program Más Médicos para Brasil. There were 700 municipalities that received a doctor for the first time in their life. After the Cubans go back to Cuba, what's the real situation? The same situation. There is no doctors for that communities, or even for the rest of the community. The 80% of the doctors for that program were from Cuba. But because of the political reason, they decided to stop the cooperation. This is one question for all of us. Can you imagine how much more we would have been able to advance in the development of the country if we had been able to have resources available for all of this time? The result of Cuba and also for the rest of the world. Despite that, Cuba ratified the willingness to protect the health of our people, no matter how many obstacles, okay, we we will face. Okay, Cuba ratified the willingness to continue doing that. I just want to finalize. I just want to finalize this presentation with some word of Fidel, and I quote: "We are a small country, but this small country has been able to show how much you can do when do you want. How much you can if the human resources of any country are well prepared and well used." Is that exactly what we are doing? That's why the government of US cannot forgive us humanity, solidarity over capitalism.